of the foremost organizations, we welcome you all. This is a live stream on a daily basis at 7 o'clock Pacific time, 7 a.m. Pacific time, talking about healthcare personalized, so-called HIP, health insurance personalized. I'll be talking about different topics and foremost organizations effort efforts to put upfront to the folks, all the Americans, the options they have, how can be how they can self-insure. Not only that, I'm sure a lot of people are saying we don't have the money. We don't have the money to. Everybody seems to have given up and embracing for the single payer plan and one size fits all approach. But I will keep emphasizing there's nothing like having freedom, folks. Foremost organizations want to emphasize the freedom you have in healthcare. That's what this is all about. No matter what the Washington comes up with, there are already people out there, the technology companies, all these big, large companies are investing in the so-called HSA accounts. Once you qualify for a HIP, once you have a HIP, it's called Health Insurance Personalized, so-called HDHP with the HSA. HDHP is basically a deductible plan, but I renamed it as health disclosure, healthy pricing that will lower your premium basing on the segmentation, folks. This works good on segmenting the risk, not the general risk pool, as it is seen nowadays with the traditional insurance companies. Ultimately, this is going to happen. They have to segment the risk. They cannot raise your premium because the government's not taking care of the illegal Americans, not taking care of the uninsured. It is costing hospitals, providers, nominal leg, and Medicaid, Medi-Cal. Basically, they are not providing the services, folks. So let's talk about today's topic is going to be, yesterday I mentioned about small groups, like under 50 employees, how they can group together, lump together, and have the same provisions as a large employer group. They can get the discounts, they can get premiums can be lowered. If small companies like myself, I have about 30 employees, if I have to get insurance, workman's comp needs to have embrace the health insurance, folks. Health insurance personalized. The workman's comp just can't focus on the workman's comp. It has to embrace the health insurance. I think ultimately it's going to happen because employers can't afford to be paying workman's comp and health insurance separate. So they need to merge. Ultimately, I foresee something is going to come up with single player plan. Again, you have workman's comp and a single player. It's I'm not sure how that will work because employers cannot afford, in addition to the workman's comp, they can't afford to pay, not only with the rise in minimum wage, they can't afford to pay health insurance on the top of it. They have to have health insurance personalized with workman's comp. So today's topic is, let's come back to today's topic. If one of the members in the family is impaired, how do we address it? Yesterday, we talked about certificate of guaranteed coverage. We talked about family members. If one family member is impaired, he can be isolated and can apply for a certificate of guaranteed coverage from Health Review Board. Once it is determined, the insurer has to participate in that exchange, and they will be able to get the coverage what they need. So it doesn't affect the rest of the family. Today we talk about this same impaired health support plans. It's hard to know for sure how many people are truly uninsurable. It is really hard. But there's an ample evidence the number and the costs are much smaller than previously assumed. Yes, it has been, we don't know the numbers, how many are impaired, but I think their numbers are smaller than what it is. Affordable Care Act, so-called Obamacare, proved the number of uninsurable individuals to be lower than expected. That's what Obamacare came up with. Included in Obamacare was a 3.5-year transitional program known as pre-existing. This transitional program was a program known as pre-existing condition insurance, so-called PCIP, pre-existing condition insurance that included under the Obamacare. That's what they embraced. It was launched in 2010. Obamacare appropriated $5 billion to finance the program. 3 years later, in April 2013, just 110,298 individuals were enrolled in the so-called pre-existing condition insurance plans, PCIP. So the numbers are small, folks. Numbers are very small. We need to really look into what are the truly uninsurable. So we are talking about truly uninsurable, so-called impaired health support plans. The Kaiser Foundation study in 2011 showed uninsured as a market as a percentage of individual market to be 2.2%. 2.2%. The individual market is only about 5% of the population, folks. Only of the 5% of the population. Based on this and the other data, they estimated uninsurable could amount to less than 1% of the total privately insured population. So less than 1% of the population, if you include the total insured population. So less than 1%. This is consistent with previously described percentage of catastrophic impaired risks. Catastrophic impaired risks. Before Obamacare, uninsured were dismissed. Before Obamacare, this is all before Obamacare, uninsured were dismissed into straight-run high-risk pools. They were shunted to the state-run high-risk pools. Those pools were limited in benefits and had high premiums. They provided little to no informational or clinical support for those who were sickest and most in need of the support. I think most of those people had state-funded Medicaid, Medi-Cal. They were not getting the care. They were not getting the care because people are uninsured, the state-funded, were accessing the Medicaid program. They joined the Medi-Cal. That's the story. So personalized health insurance, so-called health insurance personalized, HIP, reverses that approach. It reverses that approach. The impaired health support plans are designed to provide maximum help. That's what they are designed for. Maximum help and support the most in need. That's what we need to focus should be on the impaired support, uninsurable group. Right now, we are not paying attention. They are being ignored. They are not getting the care what they need, including the mental illness. This is where we are having problems. Well, people who are mentally ill, we are not paying attention to those groups. The mental health is the parity laws are comparing to physical health. So when mentally ill, it's almost like physically, and they're not getting the attention, what they need the most. These are the people They need most attention. They are the, yeah. So every beneficial service and assistance will be available to those with chronic and persistent illness, chronic or persistent mental illness, physical, whatever, the physical impairment, physical disability, chronic illness. These are the people who are not insurable. We should be paying more attention to this group. This is what the impaired health support plans will provide all of the health management, condition management, health literacy, decision support programs, account-based options, incentives available under the large self-insured group plans. They are under the umbrella of the large self-insured group plans, folks. These are the uninsurable I'm talking about. They get the private insurance. This is the beauty of having personalized health insurance, personalized, so-called HIP. It's HDHP, HSA accounts. All plans, all these impaired plans will include focused on wellness. This is what they need. They're not only they're focused on wellness, recovery, disease management programs, and they get the attention the most. Right now, we are not doing it. And I'm not sure if the public option will solve that problem, because you know how the system works. One size fits all will get worse the people who need the most care, because providers and the members are not given incentives. Even providers, they need incentives. What you're doing is basically you're dragging the providers down, lowering the payments down, and it takes away the incentive for the providers and the members, and the people are uninsured. They lose the faith in the system. They stop going to see the doctor because they are not being given the proper care. We ignore them. We just put them aside. This is what is people. You have to wait in the. They have to be. They have to get an appointment. In Canada, I was told it takes about 3 to 6 months to go to see a doctor. You need to stand in line. That public option, instead of getting the personalized health and focusing the attention of the impaired group health plans, we will get the best program for the people with incentives and rewards to everyone, to all Americans and all providers, facilities. They will be given incentives to, even insurers will benefit from these plans, because we are focusing on people who need the most attention. Consumers benefit the most, and insurance companies, facility providers will be happy to provide them, because they would like to, because that's how they get reimbursed right up front. There's no billing, there's too many bankruptcies with these billings. Surprise medical billing needs to be gone, folks. That needs to be gone. We are wasting money on these intermediary organizations. This billing is one of those things we are wasting money on. If everybody gets personalized health insurance, they will be paid as you go. Yes, they will be paid as you go. And they have a rainy day fund to access to. Everybody will have HSAs. Everybody will have insurance. Insurance companies will pay. They're obliged to pay as the member gets to receive the care. After the deductible portion, insurers have to pay right up front. No more billing. No more billing, man. No more billing. Personalized health insurance assures unique coverage for the best care and treatments for the sickest among us, folks, sickest among us. It is the individual lives. It is the individual lives, including those segmented, again, not the general risk, segmented from these small group plans. Segmentation, as I talked about, there are four categories: at risk, or well category. Number one is majority of the Americans are well category, at risk category, then chronic illness category, catastrophic. There are four categories. Their premiums should be based on the segmentation, folks, not like what we have right now. General risk pool. That's not acceptable. That is not acceptable. The impaired, coming back to impaired health plans, support plans, will be forming group plans rather than individual policies. All these impaired plans will form a group. People who need the most care, they will form a group. There will be multiple plan options, folks. Even among the impaired, they will have multiple options available. But each option will be under a group contract. These are like exchanges. These are have a group contracts with insurers. This is profound, critically important difference from the old high-risk pools. Old high-risk pools were ignored. They were shunted to Medicaid, Medi-Cal. Here, they are grouped together, and they will be different. They will be focused attention on the people who need the most care. And this is what the difference is compared to the old risks. Internal to their company operations, insurers, internal to their operations, typically segment the individual and the group management administration. Obviously, they have to follow the segmentation risk pools closely and pay attention to the segmented groups of impaired plans. The group operations are generally more robust compared to the old one in providing the medical and information support programs. They'll be more robust because you're paying the attention to the impaired. The group plans offer more favorable coverages, increased medical support, and lower premiums than individual policies. Individual impaired person is no longer isolated. Individual person is participating in a much bigger group. They will form a much bigger group, and insurers will love to accept that exchanges and focus on them. That's what the insurance is all. And you can lower the premium. There are ways to lower by incentives and rewards to everyone, folks, everyone. Incentives and rewards to the consumers, providers, facilities, all alike. These group operations typically have better third-party contracts. They will have better third-party contracts and broader and lower cost provider networks. They will have much broader and lower cost provider networks. To take advantage of these options, personalized health insurance, so-called HIP, enrolls impaired health participants in specially designed group plans rather than individuals. They're all will be in the group. So they will participate as a group. They're not being isolated. They're not, right now, we are not, prior to the Obamacare, we didn't follow that. We didn't have the segmentation. We didn't have the impaired group created, focus of our attention. It was never done that way, folks. So these insurance exchanges once they get the certificate of guaranteed coverage by the Health Review Board, will facilitate, will incentivize all. It will be all consumers, and it will be consumer driven, and it will be patient centric. The whole beauty about this concept is it'll be patient centric. They will provide the maximum help and support to the most in need, which has not been done any time before. We right now we just put them away in the Medicare, state-funded Medicaid, Medi-Cal, and they are being ignored. They are being neglected. They're not receiving the proper care because providers are not interested in taking care of them. By by personalizing health insurance, this you're giving them the private insurance, folks. You're giving them the private and you're also giving them incentives and rewards to have a rainy day fund, irrespective of the socioeconomic. I'm telling you, people don't, even if they don't have it. I think this is where the government needs to help. As I mentioned earlier in my past segments, the lower income folks need life insurance, guaranteed. That's the least the government. I would love to see that, as Prime Minister Modi did to this entire 20% of the 1.4 billion people. He has given 100,000 for everyone in Indian currency, for everyone. When they pass away, the lower income group people can benefit. And how much it is cost to get the insurance, folks? Government can do that. They can buy the premium. It doesn't cost much to get 100,000 life insurance. Can the government afford to do that? Can they, instead of wasting that $3.8 trillion in the healthcare, and we're not getting anything back in return, year after year after year, that money should come back to the consumers. That is our money, hard-earned money. What they're doing is they're wasting our money in the government subsidized program, employer subsidized program. They're collecting the taxes. They're wasting almost 17.8% of the GDP. It's almost surpassing the defense, but they're wasting that money. That money should come back to us. We are the one paying those taxes, and they should invest it back in us. Can they provide the life insurance for the people in need, 100,000? Can they provide people who need, this is where I differ. I used to like the democratic values, but somewhere they got lost. I have no idea where they got lost. They want to help the poor, but they're the only way they don't want to. They basically want to hang on to it's all about the power, control. They want to control them. How do you control them? How do you control them? How do you control the Americans? By means of giving aways, so they can all the city and government employees, they're at the mercy of the government. They have to support the government. If you go into the urban areas, city workers, they're under tight. There is so much of thing going on in the urban areas, folks. Nobody knows. This voting system is becoming, I coming from India, I see this country is just not the same I used to think of, because I thought we had, the city workers, government workers, state employees, city employees. I wish they were all public privates, because once you know Democratic Party wants to control people. It's all about control. Republicans want to may get people to get rich so they can vote Republican. Democrats want to grab them in the base and keep them base and give them welfare. That's what they are good at. Giving welfare, giving unemployment checks so they can control them right in their hand and vote the Democrat. Stupid. I can't believe that. Republicans want to raise the level standard for all hardworking Americans, whereas Democrats wants to keep it, and they want to encourage more illegals. So they want more control. Jesus Christ! This is this is called vote bank politics, man. This never works. Vote bank politics, stupidity. Americans know that. Americans are not stupid. They understand it's all. As Abraham Lincoln said, this country is so unique. It can never be invaded from outside. Yes, it can never be invaded from outside. You know why? Because of the freedom we have. And we want freedom in healthcare, freedom from the shackles. All these government employees are under the shackles of the government regulations. They're under the handouts. There are more handouts, more people vote Democratic. That's what they're looking for. Control them. If we falter on the freedom, if we falter, on the freedom, folks, it's no longer impossible. This country could be easily be invaded. Already we are seeing this. We are following Venezuela. We are following, socialistic nations. We are in a mess. This country is divided. I used to think people get to, ultimately, this is what it is. The beauty about it is middle third of the Americans have swayed the election, folks. Ultimately, this is what it boils down to. Middle third. They are smart people. They are independents. I would consider myself independent. I want to be in the independent category. I'm proud to be independent, so I can sway presidency, the Congress, Senate. This is too polarized, man. Too polarized. We can't go on. If we want freedom in healthcare, folks, Americans know what is good for them. They love to shop for the healthcare. They want freedom in healthcare. They want to see their own doctor. They want to go to their own facility. They want to go to their own, do their own thing. They want to be educated. Now we have the information technology. Let's use it. Let's get to it. Let's get to the bottom of it. I can say again, as Ronald Reagan said, we will be number one. Right now, we are ranked 37th among the most advanced countries, folks. By public option, we will probably go down to 70. If you want to be number one again, yes, we need to have it. We need to shop. We need to pay the providers up front. No billing, no HMOs, no managed cares, and this Medicare is pumping this money. Departments of HHS is pumping this money into this. They took away their hat and giving it to these intermediaries. This is their job. It's easy for them to just invest in Americans. Give that same money what you're giving to the intermediaries, give it to the Americans. That same money. They can handle the healthcare better than that's what the government can. They can handle the better than what the government. This is where the public-private partnership comes in, folks. This is what I would like to see. Health insurance, personalized, create a rainy day fund for everyone, all Americans. It's mandated. And have health insurance for all, irrespective of where they stand economically and help them. We need to focus on the people we need the most coverage. Why can't we focus on that? Giving the Medicaid, Medi-Cal is not going to solve the covered California. Create a bronze plan, go silver plan. What is this class system, man? I don't like this class system. I want to be free. I want to be I want to choose my own doctor. Don't put me in a bronze plan, silver plan. No, this is our class system. We don't like it. I don't like it either. As a doctor, I'm telling you, I don't like this class system, silver, platinum, gold. This is basically you're degrading the Americans, putting them in the class system. Sorry, guys. I had to, I just, sometimes I just get into these emotions, yesterday I was talking to my old close friend of mine. He's a physician. He really believes in single health plan. He really believes in it. You can't. I know it's hard to argue with this. Some folks, it's hard to argue. But what I see, follow the example. What America is unique about free enterprise. This I'm not advocating. It's all market based. What I give the focus on people who need the most. Segment the risk, lower the premiums. That's all I'm asking. It's not an impossible thing to do. And partner with private companies. We have, this tech sector has taken off. We need to take advantage of the tools we have. Telemedicine, telehealth. That's the way to go. We can lower the cost of the healthcare, and we could be number one healthcare provider among the countries. Yes, I see it coming. And if you guys are listening, if you guys are listening, follow me. I would love to get a feedback. I would like to hear from you guys. And this is my goal. I will keep on harping, man, till the day I die. This is all I can do. Till the day health